pre and post, we can see changes, structural changes in the brain with the EMDR. And that's the cool thing, is that we can shrink your amygdala and make your nervous system less reactive, right? And so I think is really potent in being able to shift things in a really dramatic way that is unique to this modality compared to others.
Hello, everyone. I'm here today with Erin Musick, registered psychologist, ASEC certified therapist, and a 200-hour registered yoga teacher. Welcome, Erin.
Hello, thanks for having me.
Thanks so much for being with us today. I want to start out with your 30-second origin story. So, how did you find your way into therapy, and when did you realize this is my specialty?
Oh, that in 30 seconds. Okay. Early therapy work, doing a lot of trauma work. So I worked in a nonprofit and was doing lots of trauma. And so doing that more from a general counseling perspective, doing EMDR, things like that. And then kind of feeling like, okay, like we've healed a bunch of trauma, but like, what do we do now? Right? Like, how do we get people reconnected and reclaiming and feeling good in their bodies again? Because trauma resolution will do a bit of that, but not all of it. Right. So I felt like I just needed more. So started Googling and trying to figure out who can help me with that, and then found Shaw. So
Yes. Oh, I love that.
Mhm.
All right. Now, what is one current shift or trend in health or relationship work that genuinely excites you right now?
One thing I'm loving right now is sort of like rewriting the rules for couples based on what works best for them. And that's like within sexuality, but also in terms of living arrangements and relationship agreements and all of those types of things. So really, why do we have to have one bedroom? Could we normalize having two separate bedrooms? Would that be a better arrangement, right? How is it that we actually want to approach things versus this script that we've all been sort of handed that we didn't really think or recognize was a script? And
Yeah.
so starting to unpack and challenge some of those things. So that's been fun work as of late in my practice.
Yes, I love that so much. I just talked to Dr. Joe Court this morning. We did an
Mm,
interview and he said the same thing. And I
yay!
love it. Yeah, I love it. Let's get rid of the stuff that doesn't serve us anymore.
Totally,
Yeah.
definitely.
Now, if you could teach the world one essential insight about sexual health, something that really moves the needle, what would that be?
Well, there's too many things. The majority of my practice, I will say, is generally heterosexual couples, right? And a lot of cisgendered heterosexual women as well. And so with that, then I see a lot of the problematic patterns. And again, speaking of kind of deconstructing and challenging what doesn't work, we have just a real problem with penis being the star of the show. And that's just
Yeah.
like really not working for anybody. It puts performance pressure on, it creates pressure, it creates expectations. When we're met with differences in functioning or disability or ability in our bodies, that makes it difficult. And then we have this like kind of boring, linear, kind of pressure filled often, and then duties and all the things that come from that. And so it's really just like I said, I think even 3 times, I think last week, I was like, so what if like isn't done when he's done, right? To
Right.
some of my female clients, and they're like, I don't know. And I'm like, well, just think about it. Like, I don't know, like you might decide also that you're done, but maybe you're not, right? So we can change up that it doesn't have to be a one-way ticket to one destination all the time, that
Yeah.
we can have way more fun and there's way more flexibility if we allow ourselves to approach it in a more flexible, curious way.
Oh, yeah, absolutely. Now, at Health Alliance, we train many people who are wanting to work in health and relationships. So, what's the most important thing that professionals need to know in this space?
You can't know everything, so that's okay. I think there's sometimes a pressure to be this like expert in all the things, and that is impossible. So
Yeah.
so take some pressure off yourself, but at the same time, like know what you don't know and don't fake it if you don't know. So if you
Yeah.
have someone that comes in and you're like, oh, I actually am not familiar with that, that's okay. It's not your client's job necessarily to teach you, but you can invite them to share if they like. Yeah, just we're aware of our own kind of limits and our own stuff that we're maybe not as familiar or comfortable or just well versed in, and don't assume right, and don't fake it just because that ends up going sideways anyway. If you're like playing along going, oh yeah, I totally know what that is, but you don't, it's totally fine to just own that and then learn.
Yeah, I agree 100%. Like, know when to refer. And that's one of the things I love about Shaw is that we have this community of professionals and we can refer to each other if we don't
Yeah.
know something, or even if we need somebody with a certain specialty, like a pelvic floor physical therapist or physician. Know when to refer, know how to refer, and have a community that you can access.
Absolutely. Yeah. And be able to consult. I think that's a huge part of it too. And a thing that I really love about being a Shaw alum is the Facebook groups and the connection points of people going, hey, this is something that I'm wondering about, or are there resources, or hey, can I consult on this? And so you want to work in the area, but you just want to, pick somebody's brain a little bit or get a little bit more expertise. So I think that's, again, a lovely area to grow and expand your own skills. And then, yes, have a good team of folks that you feel are confident are going to be kind of backing you up and supporting the work you're doing is super important too.
Agree 100%.
Become an in-demand sexual health professional. Gain expert education and become a SHA certified therapist, coach, counselor, or educator. Hit the subscribe button to learn more.
I want to ask you a little bit about EMDR. So you're a certified EMDR therapist. What do you find the most beneficial about this modality?
I've been doing EMDR for a long time, 21 years. So back then, people were like, what? It was 2005, so it was a little wonky. We didn't have all the good brain research that we have now. I love that with science has kind of caught up. But yeah, it's a very powerful intervention, one of the most effective interventions that I know for resolving trauma. And I do think it's very flexible too, because you can adapt it to so many different kind of, applications and protocols. It pairs very nicely with so many other therapeutic modalities. So it's not like there's ever going to be this, I am doing EMDR and it's like this scripted, weird canned thing. Like if anyone is doing it that way, that's not how it's supposed to be done. It's meant to be this really lovely addition to your toolbox that you can then integrate with more attachment-based or IFS work or more somatic work or whatever it is that you are also doing to be able to bring in different levels of healing. Ultimately, it's an exposure therapy, right? And so that is like a revisiting of trauma, but we're doing that now in a resourced, safe state, contained kind of way, and allowing people to be able to process and integrate in a way that they weren't able to when they first went through the thing that was traumatic. And then it works really great for other things outside of specific trauma stuff too, in terms of phobias or physical health stuff, chronic pain. It's great for like performance enhancement, like athletes use it for performance enhancement. So it's great for lots of different applications. So I'm a fan for sure.
Yeah. Yeah. And I was going to ask you too, are there any clients that it's especially helpful for?
I would say a good majority of my clients I use EMDR with. So I think across the board, if people are coming in with any kind of trauma history, it is definitely so relevant and so helpful. But also if we've got performance anxiety or we've got pain or we've got disconnection from the body, even like people that are just more dissociative and kind of have a hard time, we can use it just to start to track sensations and grow awareness and be able to follow a little bit through the body. And so I use it a lot with all my individual clients anyway, certainly. And if I've got couples where I'm seeing trauma is a primary thing that's happening and I'm not treating it within our work, then I do definitely make recommendations that they get some support for individual work as well.
Yeah. And what makes EMDR different from other modalities? Like what makes it unique?
There certainly is a neurological component of it, the nervous system component that does make it unique, and that it's not just about talking about the thing. Like there is value, of course, in therapy and being able to talk through a problem, but sometimes we can actually make it worse if we just keep talking about it and we kind of develop these well-rehearsed stories and kind of grooves neurologically, even if you kind of think about it that way. And so pre and post, we can see changes, structural changes in the brain with EMDR. And that's the cool thing is that we can shrink your amygdala and make your nervous system less reactive, right? And so I think is really potent in being able to shift things in a really dramatic way that is unique to this modality compared to others.
Oh, I love that. That is so cool. I love hearing about the science behind that you can see before and afters.
Yeah, it is pretty wild. And so that's why it's one of the top treatment recommendations for veterans, right? And for PTSD and lots of different populations and applications for it.
So if we have a therapist listening and they're like, I've heard of EMDR, I think I might want to try that. What do they need to know before they jump in?
I think the biggest thing is if you have a curiosity about it, everybody's different, but some people like to research. But I think sometimes people do too much research and then they kind of get in their own way about it. So I'm just like, if you want to just be curious with the experience, right, then find a clinician, right? So EMDRIA, the EMDR International Association, they have a directory of therapists that are certified and can offer EMDR. Like going to EMDRIA would be one, doing some searching through whatever your local kind of profile places are, like Psychology Today and things like that. But finding someone who's got some experience and some wisdom and some advanced training, and then, going and asking some questions about it, right? So the big thing is that EMDR sometimes gets a bad rap, and I think it's clinician problem, it's not modality problem. So I think there are therapists that will get trained and then they're not doing what they're supposed to be doing, right? And so
Yeah.
you'll see therapists that don't get an adequate history. They haven't established if the client has mindfulness skills. Can they actually track sensations in their body? Are they dissociative? What level of access do they have to the things that they want to be able to process? They're not doing adequate resourcing or prep to make sure that we've got adaptive networks set up. So all of that is not great, right, for clients. So do your research and ask the clinician some questions about what kind of prep do you do and how do you know how much resourcing I need and how would you set up a treatment plan for me if this is what I'm bringing in and that I want to work on.
Yeah. Oh, that's so helpful. Thanks for sharing that. All right. Now, I want to know if you could leave one message for the next generation about sexual health, about intimacy, about relationships. What would it be? And why does it matter right now?
There's way less rules than we think there are outside of legal things, like I really think there's so much restriction and suppression and judgment and shame that comes with ourselves that is so, I think, very sad and so unnecessary, but is just born into negative upbringings and confusion and lack of good education and information and affirming people around you. So it's like, ask the questions, get the information, equip yourself, right? And if you don't get good information, keep asking because you absolutely have the right to have access to good information. And then when you have all that, then you realize that like, oh, okay, so maybe that's fine. Maybe that's normal. Maybe that's not weird. Maybe, right? And we can kind of drop all that shame and judgment that comes with it.
Absolutely. I love that advice. All right. Now, you have presented with Shaw before. So tell me a little bit, what was your experience like as a presenter with us?
I love talking about stuff, so I'm always happy to show up and present. And this is cool because this is a topic that I haven't gotten to present on before. So this is new. And so I am excited to kind of bring more of my clinical works and my experience in a different way. Every event that I attend, either as a speaker or as a student, as a learner, is always a positive one. I think we have just like a lovely group of people that gather together and they have good, thoughtful questions and good engagement and interest. And like people are really passionate about being there. And I think that really changes it to present to a group of people that are like, excited to be there and want to learn. And so that always just feels really good. So I definitely felt welcome. And like people were keen to hear what I have to offer.
Yeah. Oh, I love hearing that. I think we do have a really passionate, engaged community, and it just makes the event so much fun.
Definitely. Yeah.
All right. Well, thanks so much for being with us today, Erin. If you want to learn more from experts like Erin Musick, check out our upcoming events on our website at sexualhealthalliance.com.